the 2022 ESMO Sarcoma and GIST Symposium was a great success with over 750 participants. The first day was essentially a preceptorship and an advanced course, and that went very well with a lot of audience participation. And one of the major things regarding this conference is that it's primarily a mentoring and teaching symposium to teach the next generation of sarcoma doctors and researchers, which is a very important function in terms of treating patients with rare cancers. And this component of the meeting covered the management of local and advanced disease, as well as specific sessions on adolescent and young adult sarcomas, and also gastrointestinal stromal tumors, or GISTs as they're commonly known. On the second day, there was a keynote lecture by Jean-Yves Blay from Lyon in France, and Professor Blay highlighted a number of the advances in the management of sarcomas, but also emphasized the importance of specialist sarcoma centers in the treatment of sarcoma patients. And there are data from the French Sarcoma Group that have shown the clear impact on outcome of initial treatment at sarcoma referral centers. And this, I think, was the theme throughout the meeting, the importance of specialist care and referral to dedicated sarcoma centers. Subsequent sessions on the second day focused on gastrointestinal stromal tumor, again, soft tissue and bone sarcomas, highlighting a number of novel therapies and approaches in all of these very heterogeneous diseases. And then the third day opened with a session on clinical research in sarcomas, with emphasis particularly on collaborative research efforts, as well as research in rare sarcomas. There were also presentations on clinical trial design in rare cancers, radiomics and proteomics in sarcomas. And another session run in parallel by the Sarcoma Patients Euronet group discussed the role of sarcoma centers of excellence from the patient's perspective as well. And there were a number of fantastic presentations on novel therapies, as well as immunotherapies in sarcomas, and outstanding sessions on pediatric and adolescent young adult sarcomas, as well as gynecological and visceral sarcomas. So I think, in conclusion, the meeting was a great success, providing an excellent educational opportunity for young sarcoma researchers and doctors, but also clearly highlighting the importance of sarcoma reference centers, and also the importance of some of the new developments in sarcoma treatment and research.